enjoying this symposium a lot because we're learning a lot of new things. We learn the benefit of exercise, but we've been sitting down here for the last 6 hours. So why don't we all stand up? Let's all stand up and stretch a little bit, stretch your leg, and get some circulation going, right? Especially to your brain. Now, actually, we're going to do the cerebrovascular. Okay, so the topic that I was given is exercise and new paradigm to cerebrovascular disease prevention. So what do I know about cerebrovascular disease? Nothing. So the reason why I accepted the talk, because I thought it was a cardiovascular disease. So when I submit the abstract, it was all about the cardiovascular disease. And then earlier this week, I started to prepare my talk, and then it's like, oh no. It's not the cardiovascular disease, it's a cerebrovascular disease. So I was quite embarrassed, and then, but then I do what I can just to pull some talk together. So here is some differences in the prevention and control of a cardiovascular and then cerebrovascular disease. For example, aspirin might be good beneficial for cardiovascular disease, but maybe it's harmful for cerebrovascular disease. But then maybe exercise is good for both. So that's the summary of my talk. Okay. So today I'm going to talk about what cerebrovascular disease is, and then and goes on. So cerebrovascular disease refers to condition caused by disorders of the blood vessels supplying the brain. And then cerebrovascular vasculature is made up of a high specialized structure that assure constant brain perfusion necessary to meet the very high demand for oxygen and glucose. So for example, if you have a blood flow, limited blood flow to the muscle, maybe you have a muscle pain. But then if you have limited blood flow to the brain, you are in the critical condition. So it's very delicate and then high demands of blood. So in the cerebrovascular vasculature, there's a carotid artery and then the vertebral artery. So carotid artery actually even divided to external and internal. So internal carotid artery goes right into the brain and then provide blood. So ischemia or embolic event usually happen in those internal carotid artery that cause stroke and other disability. And then compared to the carotid artery, the vertebral artery are very thin compared to the large carotid arteries, the thin artery. And when these two come together, it makes the circle of Willis. And then some of them is redundant because the blood flow to the brain is so important. So within the, those are carotid artery, there's a anterior and the middle and posterior. But then the interesting thing is, anterior circulation usually goes to speech, motor, and sensory and cognitive dysfunction, and posterior circulation stroke cause visual field loss and vertigo, brainstem and syndrome, and ataxia. But then during exercise, we usually know that exercise increases the blood flow, not to the extent of muscle, but then the blood flow increase to the brain for various mechanisms. But then the intensity actually matters, because if the low to moderate intensity actually increase the blood flow to the brain, but when it comes to the high intensity or maximal intensity exercise, blood flow actually decrease, and usually more so in the middle coronary artery. And then this is related to the insular cortex, and there's a, we call it salience network. There's where you feel pain. So when you're in the high intensity and then you feel a lot of pain, but then you still need to run, maybe for food, run for your life. So you feel less of those pain because of the reduction in the blood. So during high intensity exercise, reduction in the blood flow is applied to middle cerebral artery, which cause reduction of interoceptive awareness, including pain, discomfort, fatigue, and distress, and also reduced anxiety, and then post-exercise positive mood formation, such as runner's high. So then we all, hear about, stroke and aneurysm. Those are the most significant and most prevalent, cerebrovascular disease. But then I'm going to focus a little bit more on the other side, which I'm going to talk about. So, in the title that I was given, there's a new paradigm. So what's new paradigm? So I'm working on the new paradigm, which is a salutogenesis. This is something that I've been working on for the last 2 years. So what is salutogenesis? You may never heard of it. So Professor Aaron Antonovsky, he was an American Jew. When he went back to Israel to start the medical education, he did a good job. But then he also came up with this new term, salutogenesis. So salutogenesis, even though you never heard of it, actually if you Google it or if you do a PubMed search, there's more than 4,000 articles. So it's not a new concept. And this publication that it first introduced the salutogenesis has already been cited more than 17,000 times. So what is salutogenesis? Salutogenesis is a combined two word. One is salus, and the other one is genesis. Salute is like saying hi, salute, meaning like 안녕, well-being, peace, shalom. So salute is the name of a Roman goddess. But then Genesis is origin. So it's origin of well-being. We've been talking about the pathogenesis for the last few hours. What caused this disease? What infection or what germ caused that disease? So what kind of vaccination do we need to have? That's very pathogenic approach, which is nothing wrong. We need a pathogenic approach. But when it comes to lifestyle disease, for example, chronic disease, cardiovascular disease, diabetes, then there's not a single cause. So then targeting, having the pathogenic approach is good, but then it's very limited application. So what about salutogenesis? Instead of studying what makes people sick, salutogenesis study what makes people healthy. Exercise, eating, sleep, and stress management, these are very important for salutogenesis. But then another thing that the concept that was introduced by salutogenesis, which I think is very important here, they look at disease differently. When we look at disease, in a traditional point of view, pathogenic point of view, we divide people with either sick people or healthy people. Do you have a cardiovascular disease or no? Do you have a cerebrovascular disease or no? It's very binary. But when it comes to a salutogenic approach, it has a little bit different. This disease is combined with a dis-ease, dis-ease. So everybody here is either we are in the dis-ease or ease continuum, where somewhere here. It's not like binary, it's a continuum. So for example, if somebody has a cerebrovascular disease, probably all of us have that, in certain degree. All of us have arteriosclerosis, especially, lunch hour talk, Jeon talk about over 50, and I feel like, I'm over 55, we're getting there, right? So we're continuum of developing cardiovascular disease and cerebrovascular disease, and what are we gonna do about it, So traditional point of view, until you have the disease, you cannot do anything, but then from this perspective, anybody, all of us could be a recipient of salutogenic approach. So from now, instead of stroke, so what about going into arteriosclerosis, perfusion? So I'm going to explain to that. So a lot of people with a cardiovascular disease or type 2 diabetes have an increased risk of Alzheimer's disease. And this is progress. Cardiovascular disease risk factor, cerebral vessel disease, cerebral pathophysiology, cognitive impairment, impaired cerebrovascular function, and then impaired cardiac function, and then cognitive decline, and then Alzheimer's disease is a progression. So those people with arterial fibrillation also have an increased risk of dementia. And this is like A, B, C, and then within the B here, we see including lifestyle modification. And this is in the progression, the mechanism of how this cardiovascular disease or cardiac contribution to the brain dysfunction is a cerebral hypoperfusion. So hypertension also increases the risk of Alzheimer's disease. And then here, microvascular injury, and then it goes to hypoperfusion here. So, and then also blood-brain barrier disruption. And this is a neurovascular unit. Okay, so here is another thing like early dementia, early Alzheimer's disease, like blood-brain barrier integrity is not there. So a lot of toxin actually goes into the brain and cause damage to the brain. And then here is the figure that explain about that. So recently, like 2020, like Lancet actually, they published this paper, and then this paper has been cited, crazily, like, it's been over almost like 5,000 times. Because what this paper is talking about is there's 12 risk factors account for 40% of world dementia. And these are all modifiable. And then first thing is physical activity and obesity and exercise, and all that. So it's like exercise and lifestyle change can actually, decrease the cognitive decline in the Alzheimer's disease. In some case, it actually can regress cognitive impairment. And then this is a vascular contribution to the cognitive impairment in dementia. And then here, it's all talk about the process. And the early detection and management of vascular risk factors may offer an opportunity to prevent delay cognitive decline. And within the brain cell, I've often talk about like perfusion, like hypoperfusion and blood barrier, brain barrier. But then a lot of this, actually here, especially the brain area that is vulnerable to hyperperfusion is where it's very, the section of the brain that needs a lot of energy demand. For example, here, this is posterior cingulate cortex, precuneus, like hippocampus. This is talking about highly energy demand, vulnerable, estrogen sensitive, vulnerable to mitochondria and metabolic disease. All this is a target when we look at the image of the PET scan. This is where people look at if they have a dementia or Alzheimer's disease. So those areas that needs energy, if their energy is not provided enough, it causes cognitive decline, it can cause dementia, and then also the Alzheimer's disease. So something to think about, not only prevention of stroke or vascular dementia, but improve cognitive and emotional health. Brain from a metabolic energy perspective. This is another perspective that we should have. So only brain weighs 2% of our body weight, but then use 20% of our energy. It's very high energy demanding. So they need blood, right? So then if the blood, is reduced to the brain region, actually cause hyperperfusion, and that's actually risky. So what about the intracranial atherosclerosis? Does it increase the risk of dementia and Alzheimer's? Of course it does. Okay, so, and also they look at the autopsy, some of the observational studies and autopsy studies, and they all see that majority of Alzheimer's disease patients have intracranial atherosclerosis. And then Dr. Jeon, beautifully talk about, the exercise can regress, those are atherosclerosis and stenosis. So it also applies to the brain. But then what about if the brain goes to the brain? If the blood goes to the brain, and then what about the ATP production? Brain only uses glucose as energy, and then most neuron has a glucose. Actually, I changed this, but it does not. Anyway, so although most neurons have a glucose transporter 3, which is actually independent of insulin, some neurons, especially high demanding, for energy, like hypothalamus and hippocampus, they also have a GLUT4, and then GLUT4, like insulin resistance can cause a significant problem of lack of the glucose delivery to the tissue and actually cause a decline of cognitive function. So what if there's insulin resistance in the brain? So glucose uptake is limited in insulin-sensitive brain cell. And then actually insulin resistance in the brain can cause many problems, because here actually insulin can control the appetite and many other things, and it's not controlled. But then unfortunately, people, the post-menopausal woman actually have a smaller brain volume in the gray and the white matter, and significantly decreased glucose uptake compared to age-matched male. And then also we can see that here. And then with glucose uptake is significantly decreased in the brain of a post-menopausal woman, because of a lot of that is because of estrogen deprivation effect. Okay, I'm going to skip that. So not only Alzheimer's disease, but brain of people with impaired fasting glucose also have a reduced glucose uptake in the brain and insulin resistance in the brain. And brain insulin resistance is associated with the diabetes and Alzheimer's disease. So, I worked with the, insulin resistance for many, many years, but then it's only recently actually brain insulin resistance is mentioned more and more. So insulin resistance in the neuron can cause cognitive decline in Alzheimer's disease. So I'm talking about the glucose being delivered to the brain cell, but then what about, even if the blood glucose enters the cell, if the mitochondria is not functioning properly, brain still can suffer from lack of ATP. Because mitochondria dysfunction in the brain can cause central insulin resistance and the risk of diabetes actually increase. And the mitochondria dysfunction increase mitochondrial dysfunction, increase the Alzheimer's disease risk, and it's also ADHD, depression, and even cancer nowadays. So mitochondria actually is a very, nowadays actually highlight and getting the spotlight of many chronic disease. Here, look at the unhealthy mitochondria and brain disorder. It's like almost everything, like Alzheimer's, Parkinson, Huntington, ALS, developmental delay, vision loss, brain cancer. So mitochondria is playing an important role because we always thought about mitochondria as ATP production, like factory for ATP. But it's more than that. It's metabolic regulation, especially in the brain, maintain balanced glucose and ketone metabolism. Synaptic plasticity also requires energy, as you can imagine, and need ATP. Neurotransmitter production, like modulation, also need energy and needs ATP. So cellular stress response, and then when there's a cellular stress, they need to survive, and they need energy to survive. And who provide energy? Is the mitochondria. So mitochondria is extremely important for brain and synaptic transmission and all this, all talking about that. So then, what do we do to increase the mitochondria biogenesis? Peter, what do we do? Exercise. So we need exercise. Here I talk about metformin because it decreased the insulin resistance. Actually, we see metformin improve the cognitive function, but then higher VO2 max is associated with the lower gray matter and blood flow and thicker cortex. And exercise and metformin counteract And then this is all talking about the exercise actually restoring the insulin resistance, not only in the peripheral tissue, but also in the brain. And how to improve mitochondrial biogenesis and function. And there's many different mechanisms that we all heard today, and same thing apply to the brain. And then exercise training improve vascular mitochondrial function. I mean, I just cited one article, but there's more articles talking about the role of mitochondria for vascular health, endothelial function. So mitochondria is important for that too. And it's another study talking about hippocampal mitochondrial function actually improve with the exercise. But then how does it do that? Like, exercise improve the cardiac output and the hemodynamics and actually increases cerebral blood flow, and then fluid shear stress and nitric oxide overproduction. Actually, this is important for brain health. But then also exerkine, exerkine is also important for that. And then these are the exerkines that we talked about, like BDNF and the IL-6 and all this. But then usually we thought exerkine is only secreted from the skeletal muscles, but it could be secreted from other organ. But then regardless where it's secreted, all of them actually have a very positive effect on the brain. So that's why it's important that we move our body and exercise. So exercise training increases the size of hippocampus and improve memory, and this is not surprising. And hippocampus volume change was associated with the VO2 max and BDNF and memory. So VO2 max was associated with the cognitive function regardless of sex and educational level, and then beta blocker usage. And this is another study, it's a finger study demonstrated that 2-year diet and exercise program prevented cognitive decline, which is not surprising. So to summarize my talk, since cardiovascular and then cerebrovascular disease substantially increase the risk of cognitive decline and dementia associated with mental health disorder, the treatment paradigm should be shifted from focusing solely on secondary prevention to proactively incorporating primary prevention of cognitive decline as a central treatment goal. This is only my suggestion. And in this context, exercise represents the cornerstone intervention within lifestyle modification strategy because it enhances mitochondrial function, improves cerebral blood flow and vascular health, reducing neuroinflammation, which I didn't talk about today, and oxidative stress, promoting neuroplasticity, and then brain network resilience. Thank you for listening. Something that I don't know, me talking something that I don't know much. Thank you.